Afternoon, ladies and gentlemen. Welcome to Medcast, where we tackle important medical topics with leading specialists. Today, we are joined by Dr. Ali Abdulwahab Abdullah, an experienced urologist, to discuss common urological issues, new treatment approaches, and the vital role urology plays in overall health. We will explore everything from urology, offering expert insights and practical tips to help you stay informed and proactive about your well-being. Welcome, Dr. Ali.
Thank you, Ali, and welcome to have me here with you.
We are so pleased to have you, and we are both called Ali Abdullah. That's the good thing.
Yeah,
Yeah. Doctor, can we have a brief introduction about the robotic surgery and the role of robotic surgery in urology
mm.
and urology surgeries?
Let's start first of all that saying that the idea of robotic surgery came from the mid 50s when the Department of Defense and the NASA thought about having some sort of having on-field hands-on
Hmm.
without the presence of individual, especially in the space stations, to fix any sort of problems, and in the warfare fields to treat and help the wounded soldiers.
Hmm.
And this idea developed slowly over the years, and the mid 80s, a lot of research came along, especially in Princeton, when they came with the principle of telepresence. Means that having your conscious inside the patient's body to do surgeries without harming the patients.
Hmm.
And until the mid 90s, when the first robots was mainly targeted for doing cardiac surgeries, came along with many difficulties to have it widespread over the world, and till the 1999 when the first surgery came along in New York, where they did the first lab collie on real robots.
Hmm.
And after that, the urologists in the United States adopt this technology since that time and till today.
Okay. So you are saying that technology is there like for 75 years now, almost.
The,
Started in the
let's
50s.
say the idea of it.
Okay,
Yeah.
but because there's a misconception with the people because they think that the robotic surgery is something new. That's why when they hear about
Mm,
any doctor is performing a surgery without the robots, they have some frustrations.
mm.
Now, as a urologist, do you have any role with the robotic surgeries in your work?
Now, since like we have an experience over the past 25 years doing robotic surgeries,
Hmm.
tackling a wide range of pathologies, especially in the urological fields,
Hmm.
from cancer, reconstruction, and even female urology. So we started here in Kuwait since 2013 when the establishment of the Sabah Al Ahmed Urology Center, and they bought the first robot in the Gulf region at that time. And since today, there has been more than 2,000 robotic surgeries being done in here in Kuwait, covering both urology, gynecology, and general surgery.
Hmm. Does that mean you do all the surgeries now with robots, or it's just like elective ones?
Mainly when choosing the right indications for the right patients, we prefer to do our surgeries by means of robotic
Mhm.
surgeries.
Now, the ongoing question that people always ask, will the robots or the robotic
Mm.
surgeries now take the role of the doctor in doing the surgeries?
This is a misconception. The robot is like a machine,
Hmm.
and it needs, especially in the meantime, a surgeon to control the arms of the robot to do the surgeries. So the conception that the robot doing all the work is, we are still not there yet.
Hmm.
But I think in the near future, with the advance of AI
Yeah.
and other stuff, maybe we're gonna see, especially if you remember the press conference of Neuralink
Hmm.
with Elon Musk and the implantation of
The chip
the
inside their
chip
mind.
inside
Yeah.
the brain, where they want to all these procedures to be standardized and done exclusively by the robots.
Hmm.
So this is a small step towards doing more complex cases with autonomy of the machine itself, without the intervention of the of man.
Okay. Now, performing a robotic surgery, does it need any like special skills for the doctor
Mm.
or special kind of special training?
All type of surgeries, especially when you are tackling or you are intervening on human body, needs a special training.
Hmm.
I have the privilege to be trained abroad in France, and like 70% of the surgeries done there was by robotic means. So I was introduced early to the robotic surgeries, trained to do them, and I did a specialized fellowship in Montreal, Canada, doing robotic surgeries.
That's very great. I think we heard in the last days there was a surgery has been done through the robot. I think by tele means
Yeah.
the surgeons was in different countries and they have done the surgery in Sabah Al Ahmed Urology Center. Is that true?
Exactly.
Could you please tell us more about that story?
Let's say that the idea of having robotic surgeries is to have a mean of having more expertise. So if you are stuck somewhere doing surgeries and you don't have enough experience doing difficult tasks and you need help, so sometimes having a telesurgery that means that having someone elsewhere that can helps you in the surgery. And this was a little bit, a lot of centers was very hesitant, especially in the United States, with the legal consequences of doing surgeries abroad and with the difficulties of communication and speed of the internet. And so it was a little bit delayed. And until recently, many surgeries have been done, especially using the Chinese robots, doing like in a wet lab. Means that having part of the pig to do surgeries, especially in the 2 years ago in a conference, robotic conference in Rome, where the surgeon was in Rome and the council or the robotic arms were in Shanghai. And it was done. It was very impressive. And we came with the idea 6 months ago, talking with the head of the department of surgery, Dr. Saad al-Dosari, to have a means to do a telesurgery between Jabir Ahmed Hospital and Sabah Al Ahmed Urology Center. And with the restriction of legislation in Kuwait, this was delayed until we have the approval of the Ministry of Health to do this surgery. So Dr. Saad al-Dosari, head of the Department of Surgery in Sabah Al Ahmed Urology Center, traveled to Shanghai and did a surgery. And the patient was in Kuwait, and it was a very successful experience.
I think this is great to have support from the official means here in Kuwait, especially with the entities like the Ministry of Health, as you have mentioned. But let's get into a little bit details in your field, which is urology. In what surgeries you use the robots mostly?
Mainly the robotic surgeries being used nowadays in doing especially cancer cases, especially in the urology field, and kidneys, doing radical nephrectomies or partial, just meaning removing part of the tumor and preserving the rest of the kidneys. Bladder cancer surgeries, big surgeries, demanding surgeries, especially when done in a conventional way. And the robot has been a very useful tool to enhance the recovery of the patients and, of course, the prostate.
Okay. Did it give any advancement regarding the timing of the surgery and the precision?
In regards to, if we see like a 20 years of experienced surgeon doing an open surgery have the same outcome as me, a surgeon with like 4 years of experience. So it's like narrow the gap of experience between open and doing the surgery robotically, having the experience to be gained much faster. And the benefit for the patients, more precision, less blood loss, faster recovery, and regain regular activity as fast as possible, which has many economical advantages.
Does it need like any kind of special follow-up after the patient finishes the
All
surgery?
patients who underwent any type of surgery needs a follow-up, regardless, depending on the type of pathology they have.
Dr. Ali, we are so pleased to have you today. Hopefully, we can meet you again in our program and we will see you again.
Inshallah.
Thank you so much.
Thank you very much.
Thank you. Our dear viewers, we have reached to the end of our segments with Dr. Ali Abdulwahab Abdullah. Hopefully, we can meet you again with another medical specialist. Until that time, see you later.